Hello, everybody. Please note that today's session will be recorded, and welcome to this installment of our Pace College of Health Professions Dean's Roundtable. It is great to see you all here, and I am so very pleased to be introducing our speaker, Paule Joseph. Dr. Joseph is a Lasker Clinical Research Scholar at the National Institutes of Health and a Distinguished Scholar at the National Institute on Alcohol Abuse and Alcoholism and the National Institute of Nursing Research. She is chief of the Sensory Science and Metabolism section at the Division of Intramural Clinical and Biological Research. Dr. Joseph earned an associate's degree in nursing at Hostos Community College, a Bachelor of Science in Nursing from the College of New Rochelle, and a family nurse practitioner Master of Science degree from Pace University. She continued her education, completing the Executive Master of Business Administration program from Quantic School of Business and Technology to earn an MBA, and then also went on to earn a PhD from the University of Pennsylvania, conducting her research at the Monell Chemical Senses Center. She then completed a clinical and translational postdoctoral fellowship at the National Institute of Nursing Research, sponsored by the Office of Workforce Diversity. We're so privileged to have her with us today and count her as a loyal PACE alum. Dr. Joseph is currently conducting preclinical, clinical, and translational studies to improve the diagnosis, prevention, and management of chemosensory disorders. Her insights have been highlighted in various media outlets, reflecting her role as a leading voice scientist, scholar, researcher in the field, who also understands practice as well. Her research explores how taste and smell influence health, especially in those with chronic illnesses. Dr. Joseph, welcome to our Roundtable series. We are so pleased to have you with us. At this time, I would like to turn it over to you to share a bit about your experience and your journey at PACE and beyond, and how it has been beneficial to your career path.
Thank you so much, Dean Ty. Thank you, everyone, really, for joining and for this invitation. I am very excited, and I'm so proud to be a PACE alum. PACE has really played a pivotal role in my career, which I hope to share with you. So I was asked to engage with you today, I was told to probably give you a little bit of my background and how I got to where I am today. So I am originally from Venezuela, and both of my parents are Haitian. And I moved to the US when I was 16 years old, with this idea of just a better life and just more education. And as you heard from my bio, I've been in school forever. It seems like it. But, you know, one of the things that have been extremely important to me has been research from a very early age, and just engaging in research even through my clinical practice as I worked both at Mount Sinai Hospital, which I see Heather Dennis here, who we worked together when I was a clinical nurse on the floor. And many of these clinical, the clinical observations that I had working with patients has truly informed the research that I do today. And I really like to highlight that. One important thing for me has always been to marry my clinical expertise with my research, and not really having to give up either clinical practice to do research, but to really integrate both of them as I move forward. So one of the things that was very interesting to me clinically was the observation that individuals that have weight loss surgery or bariatric surgery, as we used to say it, often complain that food didn't taste the same anymore. And also one of the things that was a very clear observation even later on was that many of these patients actually develop addiction when alcohol. So one fascinating thing for me was like, you know, why is that? Why is this happening? So little did I know that this was sort of like where my research was going to take me. But taking a few steps back, just one of the things that I did was like after my bachelor's degree at College of New Rochelle, I went to PACE for my family nurse practitioner degree. And it was really at PACE in which I had this experience. It was one of the only programs that had cadaver dissection. And I was fascinated by that class. I was fascinated by the ability as a nurse practitioner student to be able to have experiences that often were given to medical schools, but to actually see and, see the brain and just see other organs and just really fascinated by that. And then really, that was a really pivotal point in my education as well at PACE. One of the other experiences at PACE that I have tremendous gratitude for is the ability to contribute to literature. And together when I had the opportunity of working with Dean Feldman, as well as Dr. Jeffrey Ruiz, who recently passed, in the encyclopedia that they had, and a number of other activities. And it was there that really just sort of engaging in the ability to contribute to scholarship was sort of instilled on me. And just really having that opportunity to, and motivation from the faculty to think about getting a PhD, to really push forward. And, I thought that I would finish and just go directly and start practicing right away, which I still did later, but just to really start thinking about science and becoming a nurse scientist. So I'm really grateful for the encouragement, for the mentorship, for the sponsorship, for the many letters that were written by the faculty that encouraged me to sort of go in this direction. And, today I'm an investigator at the NIH, as it was mentioned. I run my own program of research as a nurse scientist, both conducting animal research as well as clinical research. And just really always learning and always growing. One of the things that there's not a lot of nurse scientists, especially at the NIH. So to be able to be in a position where I can contribute to knowledge that is interdisciplinary, where I'm still the only nurse scientist that has been formally trained on how to measure and do research around taste and smell, which really positioned me at a key role during the COVID-19 pandemic. So one of the things that I always got questions while I was doing my PhD was, why do you want to study taste? Why do you want to study smell? Like, why do you want to study genetics? What does that has to do with nursing? What does that has to do with nursing science? And, it really challenged me. And it really challenged me to think about those questions and how all of that could be done by a nurse and by a nurse practitioner. So I stood steadfast into my passion, and I continued to do the research. Little did I know that the research that I was doing would actually be so important during a global pandemic. So that led me to be the co-founder for a global consortium around taste and smell that collected data on over 70,000 participants around the world, for which we have tons of data still available for people to use, but also to be able to inform policies that have that through our publications that were applied by the WHO as well as the CDC. So if you got asked the question about, did you lose your sense of taste and smell when COVID, it was really truly informed by the research that we did along with other individuals. So that was really rewarding just to see your science in action. So I will stop here for now, but I'm happy to answer any questions that that the students have or the faculty have. But I'm really grateful again to that motivation that I got at PACE, for that encouragement and the engagement that I had to do scholarly work at an early point in my career. So from one publication, now I have hundreds of them. But you need that. You need that one first publication. The first grant that I ever received was actually at PACE through the Jonas program. And even though it was $500, which was probably doesn't sound like a lot of money, but it was $500 of a peer review grant. And that has carried so much weight even into when I got into the doctoral program. So, I mean, now, of course, I manage a much larger budget, but that experience itself has been very valuable. One of the other things that I can actually share that has been one of the decisions that I made in terms of going back to get an MBA degree. One of the things as a scientist, we have to manage large budgets. We need to manage people. But there's no training. We really don't have a lot of training into that. So I figured that one good way to gain the skills into management was to really go back and just learn the language of business and how that could be applied to my research and to my science and to my laboratory. So that's one of the reasons why I made that decision. So I wanted to also share with you. It's not that I just want to stay in school forever, but it has been truly strategic for me to really think about the roles where I want to be as a leader in science, as a neuroscientist leader, but also how to manage budgets and some of the more administrative things that we cannot avoid.
Paule, I don't know that I have much of a question, but I certainly am a big fan, as you know. I admired all your work over these years, and I'm very proud of everything you did and the role that PACE played in that. In terms of your research, I'm sorry it came on late because I was having issues with trying to figure out one of the codes to get in. But did you speak about or give some examples of specific research that you've done in the past beyond the sense that, the smell and taste pieces, or has that had been your whole focus for quite a while?
So that great question, Dr. Feldman. So one of the main areas, so even though I do study taste and smell, but I study it in the context of chronic diseases, so primarily obesity and substance use disorders. So a lot of my work has really truly been in obesity. I started doing work in kids, so really trying to understand how food behaviors and parental behaviors impact kids' eating behaviors, but also just really sort of going back to addiction. One of the experiences that I had here at PACE was actually through my clinical rotations. I was working with Dr. Dunner up in the Bronx, and it was an addiction clinic. And little did I know on how that addiction, the experiences working in that clinic, later on was going to inform my science. And this was how many years now? I mean, this was 2008, 2009. And Dr. Dunner and myself have stayed in touch. In fact, I invited him to come and speak at the NIH about his experiences working locally when individuals battling with addictions. And it's just really been, like sort of that transition from being a preceptor and a mentor to now being a collaborator in a lot of the work that I'm doing. So a lot of my work now is in food behaviors, both looking at individuals with addictions, whether it's food addictions, alcohol use disorders, as well as obesity. But I always add the context of understanding taste and nutrition, because a lot of the things that we choose to eat them because we like them. But why? What is the biology behind them? What is, how does culture and environment plays a role into our preferences? Just to be able to really develop more nuanced interventions. We have had so much work done around obesity and alcohol use disorder, but often we don't take a look at some of the more basic things that encourage us to eat and drink, like that is taste. One of the other things that that I often think about is like it's such a promising area, but often neglected. You know, clinically, we don't have clinicians trained on how to screen for taste and smell disorders, how to taste for patients for taste and smell disorders. And now we find ourselves in this whole post-COVID era plus the COVID pandemic. And when I have patients that come and tell me, oh, I had COVID, but things get, I lost my taste and smell, but I feel better now. I said, compared to what? We don't have normative numbers. We don't have clinical guidelines. So that's another part of my advocacy and work that I'm doing from a policy standpoint, is to think about ways in which we can include education for nurse practitioners and primary care providers, ENTs, on how to do this, to be able to help patients improve their health outcomes in terms of these areas, but also with the understanding that many people ask me, but why do you care so much about smell? Because it's tightly linked to brain health. It's individuals that have Parkinson's disease, Alzheimer's disease, lose their sense of smell at least 10 years before they develop any motor neuron symptoms. So why can we use this as a non-invasive biomarker to start testing people early? So that's really in the policy arena, one of the things that I'm doing. And I have the opportunity, I was selected last year as the inaugural Academy of Nursing Fellow for the National Academy of Medicine. So now I get to work within the national academies, especially on the board of cognitive and sensory sciences, to really push this agenda of let's create more awareness around this area. I also helped co-found a patient organization, which is the Taste and Smell Association of North America, which is run by patients to help other individuals who are suffering with these disorders, because it really impacts quality of life overall. So my dream is that we'll have more nurse practitioners trained in this area who are curious, have guidelines that could help the future generation of practitioners really deal with the increasing numbers that we are seeing and that we will see in individuals with these disorders. Thank you for that question. I took a little longer to answer that.
A question came into the chat here, Paule. How do you make sure that diversity, equity, and inclusion factor into your research?
That's a great question. So, by being a diverse person myself, I'm very it's always in the forefront of my mind. I make sure that this is embedded even through our recruitment strategies, on the way that I design the studies, the locations from which we recruit. I think that is extremely important for participants to see you as the scientist. So even if I have to go into a community, I will go into the community and engage with the community to ensure that the community understands how their contribution matters. So a lot of the work that I do is in genetics, and the diversity on our genetic data is really minimal. So we need more diverse populations. So that's also one of the things that, that I keep in mind as I develop the studies, but also aware of the fact of how communities of color and underrepresented groups have been, I would say, misused in research at times, and how that impacts solution participation. So I think having a keen awareness of the community that you engage in is really, really important. So that's a fantastic question. Loretta?
Oh, actually, it's me. We both on the same.
Okay.
And I think this is where the all of us initiative from the NIH come in. We did some work on that through PACE, where we engaged communities and the Caribbean communities of Brooklyn and Queens, and educating them on the importance of participating in research. But one thing I wanted to ask you, the challenges. For example, you've published tons of articles. How do you write with people? This is one of the, well, how do you know? I know also you've posted about asking for help.
Yes.
Postings you've asked after. So how do you meet those challenges? When you ask for help, who do you ask for help?
That's a great question. And so that's a two-part question. I just want to also say thank you very much for participating in the All of Us, but I'm also going to put a plug out, especially to the faculty, to use the All of Us data. Not just participating, but also leverage the rich data that we are collecting through the All of Us program. And we have a really robust group of individuals that can help from the very beginning to the end of the analysis. So just really use that resource. But to Marie's question of how do you get it done? One of the things that I learned very early on is the power of having writing groups. Not necessarily only having accountability groups, but really having groups in which you can all write together, in which it becomes a win-win for each individual that is in the group. So yes, it does not come without challenges. I think there has to be clear expectations and that are discussed. So for example, from the first meeting, we discussed where everyone is in their career trajectory. If you are a more junior investigator, do you need to lead a first author paper at this point? When are you going up for tenure? How does your ideas and research fit? So there's a number of early conversations to set up expectations. And then there's a little bit of work that goes in to try to make everything sound like one person. But it's not as simple as I'm saying. Sometimes some people fall behind. There's quite a bit of challenges. But I think having clear communications and clear goals it's extremely important to be successful. And the other thing, this is a very collaborative endeavor. I barely see a paper that's written by only one person within the field. So I think engaging students is important. I think that's something that, as I shared, that was one of the things that I learned at PACE through the participation in the encyclopedia. Just that engagement, that early engagement was very important. So then to your second part of the question about asking for help. One of the things that I did not mention, I think a lot of the things sounds very easy, the way that it gets read in a bio, but it's also identifying mentors, not being afraid of asking people to mentor you, not being afraid of asking people to sponsor you to certain things. Being also but I think it's a little bit of work from our end as well as individuals, for people to know what it is that you're doing and what are your interests. And people ask me, how do you get it done? Like, you're doing this, you're doing that, you're all over the place. Right now I'm at the airport going to Phoenix. But it's just really having a circle of mentors, having a circle of supporters. And if it doesn't exist where you are, create it. So in many of these places that I go, I create the individuals that I need. I stay connected to people. I reach out to people and ask them how they are. And when I need help, I just, it's okay to be vulnerable and say, I don't know, I need help, or I'm overwhelmed at this time. And the other thing is also important, although it might look like I say yes to a lot of things, it's not true. It's important to say no. If you cannot do something, it's super important to say no. So I have an email drafted within my emails that makes it less troublesome for me to say no to certain things, because if not, I start, thinking about it. But just really realizing that not every person that is going to be on your circle of mentors has to be an academic. There's mentors for life, for different aspects of life. And I think that's important. And just reaching out, and if they cannot help you, they will find somebody to help you. So I'm just being available and generous with your time. I think that that's also extremely important. One of the things that is very important to me is to be visible and to be generous with my time, especially when students. So for the students that are here, just don't hesitate in reaching out to ask questions or to just to learn more about the trajectory, anything. I'll always try to make myself very available for that reason. Being generous with your time, I think, is extremely important.
Hi, Dr. Joseph. I'm sorry, I don't have a video connected to my computer. Thank you so much for your presentation today. So my name is Cindy Greenberg, and I just graduated this past year. And my dissertation was on the experience of the alcoholic hepatitis patient after they undergo liver transplant. And that's your career trajectory is so interesting to me, and your research sounds fascinating. As you probably know, alcohol is the #1 reason for liver transplant today, and NASH is #2, which is interesting. You brought up the bariatric surgery. We actually have a large number of bariatric surgery patients who fall into that category, where they do drink the alcohol, their liver becomes cirrhotic, and they end up with a transplant. So we see that often.
Yeah.
And I found it interesting that you had actually brought up the association of the bariatric surgery and alcohol use disorder. So yeah, your research is really interesting. If there's anytime you ever need any help, volunteering. I'm a junior novice and have great interest in your studies.
No, thank you so much, Cindy, for your comment, and congratulations in graduating. I always say graduation is just the first stepping stone to many more questions down the line. And one of the things that that you mentioned, and it is fascinating when you research, is that we do need more research in this area. So as you noticed, I'm in the Alcohol Institute. I'm the only nurse scientist in the Alcohol Institute. And one of the things that I would say is that don't be afraid of working in spaces that might be where there might not be people who are doing exactly what you're doing, because you'll bring that richness of your experience into that. Look into the Alcohol Institute, look at grants that could help fund your research in this area, and just really engage. Again, writing groups could be a stepping stone to a lot of collaborations and engaging in moving your science forward in ways that it will surprise you in a few years to come. But congratulations, and feel free to reach out.
Thank you so much, and thank you for the advice.
Okay. Oh, Sophie, go ahead.
So Paule, one thing that always fascinates me about your career trajectory is how you have very boldly embraced, as you were just saying, different spaces and different disciplines, and your whole career is incredibly interprofessional and incredibly interdisciplinary. And my question is, how can we make sure that our students realize this need for interprofessional and interdisciplinary work early on, while as you probably well know, the curriculum requirements are still very tunnel vision, even though we talk a lot about IP. So what can we do better?
Oh, wow. That's a good question. And I'm hoping I have answers for that. But you know, in terms of what to do better, I feel like the College of Health Professions is one of the most interdisciplinary schools that there is. I mean, you have so many programs within the school that it's a place to really foster those collaborations really early. So I would say, in terms of an idea, if this is not already happening, just how to create opportunities for students from different programs to engage together and maybe develop a project. Maybe I know that the curriculum is very tight and there's barely much time to add an additional thing, but I think that most of the work that we do as all of the work that we do as clinicians is already interdisciplinary. So to be able to have something that sort of connects these threads within the school really will create that those experiences early on for the students. The faculty is doing that. The faculty is very collaborative. So can we model something similar for the students as well? I think the other thing that I would say primarily for the students is to not be afraid of being the only one. I know that it's hard. I know that it's difficult, but our voices as nurses and nurse scientists is critical, and it needs to be around those tables. And if we don't do it, and if you don't do it, who will? So I think that one of the things that often motivates me to sort of engage in certain things is to just not being afraid, just kind of sort of going and bringing the experiences that we have as nurse practitioners to the table and adding that voice to the conversation. And if we need to be visible to create change. The squeaky wheel gets heard the most, right? So I feel like we need to be out there, not to really be preaching to the choir, but really sort of bring innovation and just articulate why are we needed, how we see that our science and our clinical expertise adds to the table. And I think that this is something that at least I experienced a lot at PACE. It was really embedded within the conversations and the experiences that I had. And I will encourage the students to really continue to engage even after graduation, just being bold and going to meetings and raising your hand and introducing yourself by saying, my name is, Dr. Paule Joseph, and I'm a family nurse practitioner and a scientist. So people know your career trajectory and they understand from which perspective you're coming from. I hope I answered some of your questions, Sophie.
Thank you so much, Paule. I think, also programs like this where students have an opportunity to hear you and the bold choices that you made educationally and professionally, I think is probably one of the most inspiring ways to foster that. So thank you.
I love this. I mean, we didn't have this when I was a student, but that was many months ago, and I feel like it was years, like maybe over a decade now. So this is great.
Here I am again, Paule.
Yes.
You wound up at the NIH.
Yeah.
For students, could you share with them how did you end up at the NIH? What was
Sure.
How did you get there?
It
seems so far away from our everyday realities.
That's a great question, and I, as I said, I just kind of made everything sound very linear. So how did I end up here? I would say networking. So I attended the Eastern Nursing Research Conference, and I was at the elevator, and there was this woman at the elevator who we were talking about everything else about the beach and South America and the Caribbean, then turns to me and asks me, so what did you do thank goodness I had my 3 minutes elevator speech, and I said, well, I'm a doctoral student at University of Pennsylvania. I'm studying this. My goal is to do this and that. And these all happened literally in the elevator. That's why they tell you have an elevator speech. But and after engaging in conversation, she said, oh, maybe you should come and do a summer internship with me. So this was probably 2013. But in 2012, I attended this Summer Genetic Institute, since I said that I do a lot of things in genetics, which was NIH. And before that, I only knew that the NIH was the place where researchers applied for grant. I did not know that there was a whole entire intramural program. I didn't know that there was a whole entire intramural program of nurse scientists leading research in different areas. So later on, when I met Dr. Wendy Henderson, who was then became my summer intern, mentor, and then I returned back to the NIH to do my postdoc in her lab. It was that I really sort of learned more about the NIH, like the contributions of neuroscientists, and really it was through that networking, I would say, that I got these opportunities. It was not something that it was readily apparent to me in undergrad or even through my master's program. But again, I think one of the things that has been very important to me is to share the opportunities that we have within the NIH for students, because that first opportunity, it might not necessarily mean that, later on you'll become an investigator at the NIH, but you might be able to gain knowledge that helps other students down the line and the future generation of neuroscientists or scientists overall. So I think it's like one of the biggest sources of disparities, even within education, is the lack of knowledge. So for me, it's if I can contribute to sharing that knowledge about these opportunities when people, I'm happy to do that. So if you have students that are interested in summer programs, in postdoctoral fellowship, we have programs that are available for post-baccalaureate individuals, so individuals who finish their bachelor's degree and want to do at least 1 year of research. There's opportunities for faculty to do guest research, become guest researchers. There is opportunities for individuals who are getting their PhD at a school, maybe at PACE, and then they can come into the NIH in a graduate partnership program to complete their dissertation work within the NIH. So there's tons of opportunities, but if these opportunities are not known to people, then I believe that it would be difficult for some individuals to see themselves winning these opportunities. So I'm happy to share anything with any of you, and with the students as well as the faculty.
Paule, I was saying it was so good to see you. Oh my goodness, it really warms my heart to see you. So I'm an adjunct professor with the psychiatric mental health nurse practitioner student, and my question is for you is, how does a nurse scientist stay relevant with artificial intelligence and this technology? Right, with this it's all about technology. It's all about, right? My son, he's like, Mom, I could just go on ChatGPT and get whatever I need, right? Like, how do we, motivate ourselves and others and so forth?
That's such a great question. There's a lot of discussion on how we can utilize AI into training and practice, but also, like, I think we just need to catch up when the program here and just really be on the know. There's number of training programs that are coming up in terms of like how to effectively utilize AI. For me, one of the things that I've been it has been important for me to even play with the AI just to understand, because, you know, when students and stuff like who are like your son, who are probably far more advanced than we are in the utilization of the ChatGPT and some of these things, if we are not really knowledgeable about the technology, how can we be competitive in the discussion? So I think that it's important to read. I really believe that we need to create opportunities to for each other to read, you know, beyond our disciplines, to really engage. You might ask yourself, how do you have time to do all of this? But, you know, we have audiobooks, we have different things. I think it's important for us to sort of push ourselves and create time to acquire additional knowledge. I think that's extremely important. Yes, in Thai.
Yes. In other talks that we've had, I've been so amazed at the range of nonprofits and volunteer work that you also do. And I'm wondering, especially for students who might be watching the recording later, what have you found most helpful in addition to saying no in terms of time management? Because you have so much that you've achieved and so many things that you do.
Yes. Yes, indeed. And I didn't get a chance to share a lot of my work with nonprofits. I do a lot of work in Ghana, in India, and other places. And you know, and I have to say, before I answer specifically that question, like, you know, a lot of my work, specifically in Ghana, through Amazing Grace Children's Charity, in which we're building a children's hospital for children that will serve kids in Togo as well as the Greater Accra region, is really bringing my experience as a nurse practitioner. It was really that experience that sort of pushed you know, this public health agenda to engage in that work. But how do I manage my time? One of the things that I do is I block out time for a lot of things in my calendar. So whether it's for, you know, building curriculums for the educational program within the nonprofit, so I block the time for the activities. And I'm very intentional about when I engage and answer emails. So if I have my time blocked for writing, it's writing. And if it's truly an emergency, they will find me with my phone. But other than that, the time is blocked. For example, from like, I'm a very early person. So I would say like from 4 a.m. to 6:30 a.m. I'm writing, and I love that time because it's my time and it's my most creative time. But even during I have blocks of time within my calendar that I check emails, because if not, then I'll find myself answering emails the whole entire day, and just really not feeling at the end of the day that I'm not productive. So even for the nonprofit work, I'm very intentional in blocking time for engagement. I know when the missions are going to occur, so that's already blocking my calendar. I also make sure, since that's very important to me, that make sure that my boss and everyone around me really understand how that is important to me, so that time is non-negotiable. So those are that's some of the strategies that I use, but I think that the most effective one has really truly been being very organized in how I account for the time during the day. So I hope that's helpful. And you might say, you know, life happens. It does. And I'm flexible in that way, but I'm also, I also make sure that there's not too many fires that I need to put out every single minute. That, you know, and my team knows, like, if it's an emergency, they can reach out. I also have little things outside my door to indicate what it is that I'm doing, and they do as well, especially if they're writing.
Also, Paule is very good at what she cannot do. She'll find somebody to do it. In the sense that we at Hill Haiti, we have 3 people. She actually referred to us, and they've been very valuable to the growth of the organization. So when she talks about networking, she really means it. So when she says no, she doesn't quite say no. She just hands it over to somebody else.
That is true. That is true.
Also takes time to have fun.
That is true. I
Very
think
important. And to
yes.
celebrate.
Yes, when 2 kids and a partner who's also a scientist, yes, we need to create time to have a life besides the day-to-day of the activities we do.
I have a question. You mentioned earlier keeping up on reading and making time for that and learning outside of your specialties. Are there any
Yes.
like specific recommendations for great books that you've read recently that you think anyone could benefit from?
Yes. So now I've been like binge reading on leadership books. So I think it's there's one in particular that I would say, I think it's Be Brave. That has been, and I'm cheating because I'm checking my Audible to tell you exactly the books that I've been reading. But like, for example, The Most Wonderful Women in the Room Is You by Lydia Fennett. The Disordered Cosmos has been one of the books that I actually finished. Another one is Invisible Woman, and especially in the whole concept of how the contributions of women are often not recognized or highlighted, or just kind of how some of the work becomes sort of hidden and part of these hidden figures conversation, and just these are some of the examples, as well as one particular work that I really like, this The Language of God, that was written by the former director of the NIH, Francis Collins, and as a geneticist himself, he sort of speaks about that, the just biology and just how wonderful the genetics and the body is. And it's just really a fascinating take into science and biology. So just a very diverse, eclectic list of readings, but I think that 5 minutes a day goes a long way. As you're folding clothes and things, just popping up an audiobook, I think is really helpful. Thanks for that question. I love reading.
Hi.
Hi.
Hi. So I'm a first semester student. I'm in the adult gerontology, and right now I'm taking scholarly research with Dr. De La Bastide. And it's very interesting reading a research, and also very technical. And I just finished my cast review on one of our articles, and I saw an email for this meeting, and I was reading your bio, and I was very impressed, and that's why I came here. And I was like, should I just attend this meeting? It's like, how does a nurse, taking care of patients at bedside, all of a sudden go to research, which is dry? And I do find the research findings interesting, but very technical. And what do you think are the characteristics of a person who goes into this field, your field that you've chosen, that will be of benefit? And also another question of mine is that are there any like advancement as far as the chemosensory that's being developed to suppress or to help obesity and addiction as far as in pharmacology or therapy?
Those are very
That's a lot
great
of
questions. No, it's fantastic questions. These are the things that I get, like, you know, research being dry, being boring. Actually, I find research fascinating. I find research exciting. I find it the ability to contribute to knowledge that will transcend my own life fascinating. And I think it's just finding strategies in how to not make it dry, right? How to maybe, you know, there's different types of science that we do. Like we do implementation science. It sounds to me like maybe doing implementation science would be more exciting than just really focusing on maybe the more bioinformatic sides of the research. So I think that there's just having a clear understanding of the different types of contributions that we can have, whether it's from basic research to translational research to implementation research. I think that might change the perspective a little bit. To the question about, you know, are we developing drugs? Are we developing tools that can help patients, especially with obesity? And I think that this is the part in which, you know, building the knowledge that can lead us to interventions and treatments. So as I mentioned earlier, you know, I was trained as primarily as a clinical researcher that really got interested in translational work. So I had to spend a little bit more time on learning how to do and collaborate with individuals that did animal research, for example, like that did more basic, did cells, so we can test maybe current drugs that exist and see how that can help I don't know, decrease inflammatory processes or change the immune signature of like the cells that we are working with. And you know, that's exciting. That's exciting to sort of work towards something that can help. Where we are is that we're not there yet. We are really just building the science. So we need people like you who are here today, just kind of asking the next questions that can lead to therapies and interventions that can be functional, that can help the patients. I cannot do everything myself. That's why I love training people. And we need new generation that have innovative questions that can lead us to the next drug development. I mean, we have the GLP-1 agonist drugs, right? Everybody's very excited about Ozempic and Wegovy and all of these things. And I'm very interested on how that particular drug changes individuals' taste perceptions. One of the things that patients sometimes say is like, you know, the things don't taste as sweet anymore. But why? I want to understand the mechanism, what happens between the brain and the gut, what is the signals that change that lead to those reports. And if we understand that, then maybe we can also understand how to develop a pharmaceutical intervention as well, or maybe intervene in other ways. But we need to build the knowledge, and we need to be at the forefront of building that knowledge. So I would encourage you to look at research with a different lens and just really engage in thinking about how what you're reading can be applied, and how you can add your own voice to disseminating the research. How can we disseminate the science to the public? One thing that we know is that nurses, we are the most trusted profession. We can play a role in decreasing misinformation and disinformation. But how can we do that if we're not engaged in understanding the science and staying on top of the science? It's very critical. So we need you in science.
Thank you
in
so
whichever
much.
way.
Yes. it's been very interesting, like reading research. Actually, this classes is forcing me to read research. While it's like very tedious, it's also very, very interesting at the same time. Also, the process of developing research and these questions, it's very interesting to me, but it's very daunting when, oh God, is this something that I want to like go into? But like maybe it's too much for me, you know. It's like, do I have the capacity? Do I have the focus?
You
Do I
do.
have, you know? So
You do. It's
and
in
I'm
there.
so glad that
Baby steps.
yeah, I'm so glad that I did join this meeting. And
I'm
I
glad.
think you're very inspiring. And thank you
Thank
for
you.
all the advice and the updates on all of your work. Thank you so much.
Thank you. Now we need you. We need the students. We need new people asking innovative questions, and we need the diversity in our voices to contribute to knowledge and to you know, to the science overall and to the literature. So if I end with anything is write. In nursing, we always say if it wasn't written, it wasn't done. So if you don't write, nobody will know that of what your contributions are. So I would encourage you to not be afraid of research and not be afraid of writing, and just really starting at baby steps. It's very important, engaging with the faculty, and for the faculty to have opportunities for students to engage as well, because those opportunities that I got at PACE were very transformative and really helped me into becoming the scientist that I am today. So thank you so much.
And I know we're out of time, and I couldn't have said it better than Gilbert said about thank you for all that you've shared today, Dr. Joseph. And thank you also for our students, faculty, and staff who've taken the time to attend, and for those who will learn from your wisdom from the recording, who will be watching later. Thank you again, and safe travels.
Thank you, everyone. Thank you so much.